Hi everyone, welcome back to our channel. We're very excited for today's episode on the Truly Mama YouTube channel. We are joined again by Dr. Kristina Arion, an OBGYN resident, and she's here to come back and talk to us about what's new and the latest with the global pandemic that we're all experiencing. We've heard a lot of your continued questions and concerns, and we thought it was really important to bring her on back to find out what the latest is. Welcome back to our channel, Dr. Arion. Thank you so much for taking the time to speak with us again today. The first question we want to ask you is, how are you holding up and what's the spirit of the healthcare workers like right now?
Hi, Jillian. Thanks for having me back. It's always a pleasure to chat with you. I have to say that times have changed. Hospitals have taken unprecedented measures to minimize the risk of spreading the coronavirus. For instance, we're no longer doing any elective operations unless it's for cancer cases. Even the emergency department visits have drastically reduced, and the ER is oftentimes empty because people aren't coming to the hospital unless they have a serious illness or, of course, they're in labor. Essentially, the only service that's running at like business as usual is the birth unit because, of course, coronavirus can't stop babies from being born. It's taken some adjusting to, but we have a great support system at the hospital, so working has been very uplifting. We're really diligent with our personal protective equipment, so we're not too worried about getting the coronavirus. We always wear masks and we really diligently wash our hands.
We hear over and over again that washing our hands is so important. So it's good to hear that doctors are feeling good, that the spirit of the hospital is positive overall, and that going to work has been an uplifting experience.
Absolutely.
So as we continue to experience these trying times, we're hearing a lot of stories about mothers who are really feeling upset and angry, just not having the pre-birth and definitely not the post-birth experience that they had dreamed of and really longed for. While we certainly understand the feelings of these mothers and validate them, we're wondering if you could tell us a little bit about what these mothers are going through and what a pre-birth and birthing and post-birthing experience really looks like for these women right now.
Yeah, Jillian. So as soon as you enter the hospital, everyone is screened upon arrival for symptoms. Women aren't allowed to have anyone accompany them unless they are being admitted to the birth unit in labor or for induction of labor. They're allowed to have one support person during that whole time until the time of discharge. If you're visiting the hospital for anything else, for instance, a regular prenatal care appointment or to the emergency department with a problem, unfortunately, you can't have anyone with you. And if you have a problem that's serious enough to be admitted to our inpatient ward, you can't have any visitors either. It is really important to maintain these protocols to ensure the safety of hospital staff and other patients, but on the other hand, it is really difficult for women to be alone during these times. So I've seen a lot of women use FaceTime to connect with their partners and friends, and hopefully their hospital visits are short, but of course, it is tough to be alone.
It's really great to hear that people are turning to modern technology like FaceTime to stay connected during these really difficult and trying times. So we're glad to hear that I guess the best is being made out of really difficult situations. While stay-at-home orders have been very clear, we have heard about a lot of mothers and expectant mothers who are following all of the recommendations by staying at home, washing their hands, following all of those protocols that have been recommended to us. But perhaps they have a husband or partner who is an essential worker and works outside of the home, and they're really worried about that person bringing the virus back into the house when they return. How can mothers keep their families safe when this is the case for them?
This is definitely a stressful situation, and really all you can do is focus on preventative measures and take them very seriously. So while the partner's at work in close contact with others, try of course to maintain a 6 feet distance if possible, wear a mask, and of course diligently wash your hands after every interaction. If your partner works in a very high-risk environment, such as in the hospital, when your partner comes home, there should be a designated area in the entrance where they should undress, put their clothes in a bag, which should go into the wash, and then take a shower. Otherwise, clothes are unlikely to be a source of transmission in regular day-to-day activities. So if you go to the grocery store and when you come home, you don't need to undress in the entrance, unless of course someone sneezes on you or touches you. You should probably wash your clothes. The virus lives for a variable amount of time on different surfaces, but it is very easily killed with household cleaners and hand washing. So wash your hands and don't touch your face.
Excellent. For those single mamas out there who are really responsible for everything in the home on their own. If they have to go out for essential items and bring their children with them, what types of precautions should they be taking?
Well, it's about the same thing. Distance yourself from others, don't touch your face, wash your hands very carefully, and wear a mask. If it brings you comfort to wash your clothes, you can do that too.
Can you tell us a little bit about what types of symptoms mothers should be looking for in their little ones when it comes to suspicion that they may have coronavirus?
Generally, symptoms of COVID-19 are milder in children than adults, and much less children have been hospitalized than adults. However, serious infection is still very possible. Things to look out for are respiratory symptoms such as cough and shortness of breath, fever. Feeding intolerances like vomiting, diarrhea, and fatigue can be presenting signs. But these are very general symptoms that can represent many different things. So be on alert for symptoms like these and call your local public health office and seek medical attention if warranted. Make sure your baby is well fed because malnutrition can lower the immune system. And lastly, do not put masks on your baby because this can be a suffocation and strangulation hazard.
That's a really important piece of advice, so thank you for sharing that with us. I can certainly see how it would be very easy to get those orders confused and put a mask on your baby, so thank you so much for calling that out. That is so, so important. This has certainly been a very trying time for so many of us, but perhaps more than anyone else, it's those new and expectant mothers that are really having their worlds turned upside down. Their experience isn't what they had hoped or imagined, and as we know, having a baby, those days after can be a really emotional, trying time. So when you combine all of this and you're dealing with a pandemic and you're a new mom, we would think that that would create a lot of really not so pleasant feelings. So what are some of those symptoms that moms should be looking out for when it comes to their mental health? And at what point should they really be checking in with a doctor?
This is serious because depression is known to affect 10 to 15% of women in their pregnancies and postpartum, and anxiety estimated around 5 to 40%. Particularly vulnerable are those women with histories of psychiatric illnesses that stop taking their medications during their pregnancy. So especially in times like these, symptoms may more easily be triggered. There's a really good depression scale that can be easily accessed online called the Edinburgh Postnatal Depression Scale and has been validated during pregnancy and the postpartum period for depression, while some questions are also useful for identifying anxiety. It's a very sensitive tool, and the score you get can indicate whether you should monitor your symptoms or seek assessment and treatment. Depression is a physical illness, and there are effects on the brain and body, and stress hormones and inflammatory markers are released. Some of the symptoms can include persistent sadness or low mood, loss of interest in your favorite things, feeling guilty or bad, increasing feelings of anxiety, and changes in your sleep or your eating patterns, among many more. An expectant mother's depression can potentially have a very real and negative effect on herself and the baby. If you are worried, you should seek help.
So do you have any general tips on what a support person can do to support the woman in their life after she gives birth or before while she's still expecting and dealing with the pandemic?
Yeah, so support people are very important, of course. Be supportive, helpful, be really good with communication, be attentive to your partner's needs and their concerns, be encouraging, and of course, a lot of reassurance is necessary.
Excellent. Well, that is some pretty simple advice. It's important advice, and it can certainly go a long, long way for those new and expectant mothers. So our last and final question for you today is, what advice would you give a new mom who's interested in really being proactive and taking care of her mental health?
So I have a bunch of general tips for you mamas. Of course, connect with friends and family regularly. FaceTime is great, Zoom as well. Stay active with some at-home exercises. I know that YouTube has a bunch of pregnancy workouts. Eat healthy and spend some time learning some new recipes. Importantly, focus on positive things. If you can, try writing down something that you're grateful for every day. Another thing that's really helpful for reducing stress and anxiety is meditation. I definitely recommend it. Apps like Headspace and Calm are great. Perhaps even try cutting your partner's hair. That might be something fun that you can try. If you are experiencing worrisome feelings, open up to someone, a friend, a family member, or your doctor. It's definitely better to keep it out than in because things can easily build up in times like these and become more catastrophic than if you had talked about it earlier. I'm not sure how much longer these times are going to last, but stay home, stay safe, and stay positive. It was really great chatting with you, Jillian.
Thank you so much, Dr. Arion. We absolutely love having you on our channel. Your compassion and your knowledge is just, it overflows, and we're so appreciative for your time. And we know that so many mamas around the world are going to find this video very, very helpful. So a huge thank you to you again.
See you next time.
See you soon. Another huge thank you to Dr. Arion for joining us on our channel today and providing so much great advice and information as it relates to being a mom in this very trying time. And until next time, make sure to leave us a comment and let us know what questions you have for Dr. Arion. And of course, if you found today's video useful, leave us a thumbs up and subscribe to our channel. Until next time, see ya.